let's talk pharmacology. It's Medication Monday. Let's talk about another medication you're going to want to know for the NCLEX exam. So we are talking about paroxetine. What is this medication? What do we need to know about it? This is an antidepressant, anti-anxiety medication given to patients that are struggling with depression or anxiety. This class of medication is considered an SSRI, or a selective serotonin reuptake inhibitor. This medication works to decrease the frequency of panic attacks, OCD, or anxiety. Okay, brain hack, I don't really have one for this, but we do need to pay attention to some precautions and side effects. That can include weight gain. I want you to note this because this is one of the most common side effects of this type of medication, okay? And note that these medications, lots of SSRIs and in paroxetine, fluoxetine, things of that nature. So weight gain is a common side effect or side effect of this medication. We also want to be aware that this medication can cause and increase suicidal ideations. We want to watch for neuroleptic malignant syndrome, or MLS. We also want to use caution with concurrent use of MAOIs. This could lead to potentially life-threatening conditions. We also want to watch for Stevens-Johnson syndrome and signs and symptoms of serotonin syndrome. And we also want to note that this can decrease libido and cause impotence. So nursing considerations, nursing interventions, what do we need to know? We want to make sure that we're educating our patient on diet and exercise, right? If weight gain is one of the most common side effects from this medication, we want to make sure we're educating the patient, letting them be aware that it is great to implement a healthy diet, adopt a healthy diet and a healthy lifestyle, incorporate exercise, things of that nature. Okay, we also want to reiterate to the patient that this medication can take 4 to 6 weeks before it has a therapeutic effect. We also do not want them to stop taking this medication abruptly because it can cause some unwanted and not so great side effects upon doing that. And lastly, we always want to monitor, obviously, and assess the patient to make sure that they are not having any type of suicidal ideations, but we also want to make sure that if they are feeling that way at any given time, that they need to notify the HCP immediately. If you found this helpful, please make sure you're following this page, save this video for later, and take a future nurse.